Don't despair. Grief Girl is here with her monthly collection of anecdotes, insights, and inspirational stories designed to tackle today's only remaining taboo topic, grief, with the one host who's been there and back, Christy Hugstad.
Well, thank you so much for that lovely introduction. I am in the studio today honoring a very important day. Today is International Overdose Awareness Day, and I'm in the studio with my two very special guests, Gil Carmona, and Gil is the CEO of Laguna Treatment Hospital. And with Gil is Dr. Lawrence Tucker, who is the medical director and addictionologist for the Laguna Treatment Hospital. So welcome, guys. Thank you so much for coming on the show today.
Oh, thank you for having us.
Absolutely. And of course, what would we be doing here without our engineer and the owner of OC Talk Radio, Mr. Paul Roberts?
Ready for some more amazing stories here. I got my crying towel out, and
maybe you won't need it today.
Maybe you won't need it.
I don't know. We'll see.
You always take me through this emotional roller coaster. These stories are so moving, and yet there's always some hope at the end. So
absolutely. But before we dive into our show, I want to go into a little bit about why I'm here and what my mission is. My mission is to help abolish stigma of mental illness, suicide, and addiction, which we will cover today. So as the grief girl, I will pull back the curtain, and I'm going to help start conversations about topics that really nobody wants to have, because I'm an advocate for all of those suffering from a loss of any kind. By loss, I don't just mean death, because that's the first thing we think of, but we really need to grieve all different kinds of losses. So, for example, if you're going through a divorce, if you've recently broken up with a significant other, you're having health issues, loss of health, you've lost your job, your trust, your identity, or struggling with an addiction. So you may not have thought about addiction as actually being a loss, but if you look at it this way, you need to grieve your addiction just as you would a death, because you can't go back. It's done. It's final. It's over. So along with addiction, there is obviously the loss of the substance itself, whether you are a heroin addict, meth addict, prescription pills, the lifestyle, the running around, the peers that you ran with, the instant gratification of that high. So all of this needs to be grieved just as a death would be grieved. Now, my show is a place for sharing and healing, and also a place where nothing is off limits or too tough to tackle. So let's get started with today's show. International Overdose Awareness Day, Saving Lives. So, Gil, I'm going to start with you. So can you tell us a little bit about the Laguna Treatment Hospital? And you're the CEO, right?
Correct.
And tell us a little bit about your role as the CEO.
Well, as both the administrator and as a licensed clinical social worker, I understand the clinical component of what it is that we treat. And we are fortunate to have the first chemical dependency recovery hospital in Orange County. And it's one of 7 in the state of California, similar to the Betty Ford Center. And so we're local in Orange County, and we've just been open for over 1 year.
Okay, by local, what city are you
We're in
located?
the city of Aliso Viejo.
Okay. All right. And Dr. Tucker, you're the medical director and addictionologist, correct?
Yes, ma'am, and also a psychiatrist. Board certified in psychiatry and neurology and addiction medicine.
Great. So can you give our listeners a little bit of background of your role at the hospital?
Sure. We're a 93-bed facility. It's a medical model, so we treat many different types of addiction, as well as dual diagnosis, including mental illness.
Right.
But certainly, like Gil was saying, since we are a chemical dependency recovery hospital, the primary diagnosis is addiction. So we treat very acute patients, some that have a lot of medical issues, along with psychiatric issues, using a medical model as far as detoxification and therapy groups, both individual and group therapy. So we do have a complete program, including dietitian, recreational therapists. So we try to involve, everything from the medical part of it, the biological part of it, and the spiritual part of it.
Okay, so you have everything under one roof then. You have the outpatient, the detox, everything, right?
Everything,
So
that's correct.
that's awesome. And you've only been around a year.
We've only been around a year.
Okay.
We've made significant gains from that last year. And currently our census is at around 70.
Okay.
So we see patients from all over the country, actually.
Right.
Especially at our facility, because a lot of our patients are very medically unstable, and since it is more of a subacute model and medical model, we're able to treat those clients there.
Okay. All right.
I think the key difference, Dr. Tucker, if you would concur, is that there's daily physician rounds, there's 24-hour nursing, it's med administration, so it definitely has the feel of a medical model versus a social model. So we're the county's first hospital-based continuum of care, which includes inpatient services and outpatient services.
Which is amazing because that is so needed in our community.
So-
And I will be honest, I work in the field, and I wasn't aware of your facility. So this is really, really exciting
Right.
news. Okay, now you are involved in an opioid awareness campaign to educate the public as to why people can't afford to go another day using drugs. So can you guys tell me a little bit about what's involved in the campaign, and what exactly does it mean by you can't afford to go another day?
Yeah, you're right. We are definitely licensed as a opioid treatment program. And now, the American Addiction Center has launched a national opioid overdose awareness campaign
Right.
called At Death's Door, a look at opioid overdose and its victims. As we've witnessed basically in front of our eyes in many different arenas, everything from movie stars, actors, to just the common folk in Midwest and from the East as well as the West, people are dying from opioid overdose. And now, this is one of the worst epidemics we've had, really, probably since the 50s with heroin. A lot of synthetic drugs are sneaking into the market, like fentanyl. Everyone's talking about fentanyl and carfentanil. Fentanyl being 100 times more potent than morphine, and carfentanil 10,000.
Right.
So we're seeing a lot of this, and the problem is when the paramedics and other people come out and rescue these people, typical Narcan, in which they try to save these people's lives, they take 5, 10, 15 shots to really get them out of an overdose. And so it's very lethal, extremely lethal. And so you're seeing a lot of drugs being cut or added to, because these drugs are synthetic, to regular heroin. So deaths are very common. A lot of them are accidental. Most people are using drugs, or they don't know what they're getting. They're typical heroin addicts, and they get these drugs, and they try to use around the same amount, but a few grains of these drugs can cause them to overdose and die.
Right. So let me understand, if carfentanil is 10,000 times more potent than morphine,
Exactly.
how could a human being survive that?
They
That makes
can't.
no sense.
They can't.
Okay, so these
can't.
addicts don't know that the heroin is cut with carfentanil.
They don't know.
Okay, and
Now,
that's a death sentence right there.
That's a death sentence. Now, occasionally you get heroin addicts that are on fentanyl, whether they're abusing fentanyl patches iatrogenically prescribed to them, or they buy
Right.
it off the market. So, they would probably dose a little bit different. But if they don't know their particular heroin that they're buying is cut with fentanyl, they certainly risk overdose, which, again, at death's door means that, that's the end. That's
Right,
the end.
and fentanyl, to me, I mean, my dad was on hospice, right? And that's, big man, 6'5", 250 pounds. That was the painkiller, pain medication that he was given
Right.
in hospice, dying from bone cancer.
Right.
I mean, that is about as heavy duty as you can get.
It is.
So for that to be the drug of choice
Right.
for heroin addicts just kind of boggles my mind.
Yeah, and it's amazing when I went through education in medical school. It will give you a history of this. Back in 1980s, Dr. Jick, J-I-C-K, wrote a brief about treating addiction, or treating pain rather.
Yeah.
And he made a comment that opiates weren't addicting. And so in the 90s, the American Pain Society came out with this statement that pain is the fifth vital sign. So we started, I'll never forget, in medical school, they taught us to ask about pain and aggressively treat pain with opiates.
Right.
So everyone in the 90s treating pain, all these opiates came out. We were treating pain so aggressively. And so this kind of spawned the next 20 years of this current epidemic of iatrogenically prescribing pain meds aggressively, to the point that I think it was just last year, the AMA finally dropped pain as the fifth pain sign.
Okay.
Up until last year, we were still calling pain the fifth vital sign and still aggressively treating. That's 2016.
So that's really interesting that back in med school, you were taught basically to overprescribe, right?
We were prescribing like crazy. That we would go in and as residents, and we asked them about that fifth vital sign, and we were handing out opiates
like candy.
Like candy.
Right. Wow.
Like candy. And again, it's amazing. Up until 2016, the AMA still considered pain the fifth vital sign.
Is that right?
We were still treating it.
Wow.
Absolutely.
So this has been going on for decades.
This has been going on for decades.
Interesting. Okay, so here's a statistic. Each day in the U.S., 91 people die from an opioid-related overdose, and the numbers are increasing.
They're increasing.
Wow, that is staggering. And let's talk about Orange County specifically. So my impression is that the beach communities like Dana Point, Laguna Beach, Huntington Beach, Costa Mesa, that's where the big problem lies. And let's not forget Laguna Woods, where, right, is an elderly population, 55 and over.
Exactly. 55 to 64 tends to be the highest opiate overdose. Remember, most of these are iatrogenically prescribed medications and are therefore addicted to medications by prescriptions. And then also there's a cohort of multiple polypharmacy. People prescribe, everything from Ambien and other opiates together, benzodiazepines, and taking the drugs with them. Certainly you're at higher risk of just respiratory depression and, of course, death.
Right.
And if you even look at over just the last year, just in Orange County, there was like 5,500 hospitalizations and about 700 deaths in the Orange County area.
Right.
Due to overdoses.
But how does that compare nationwide? Because I've read that even though the statistics are staggering and it tends to be more prevalent on the beach communities, we are still ranked lower than what's happening nationwide.
It's probably right. I mean, even if you look at nationwide, the number of deaths in 2016 were about 65,000, but that was doubled from 2015.
Yes.
So overall, obviously, it's significant. Even in 2015, the number of deaths, as far as opioid overdoses in general, were really about the peak. The same number as about the peak in the AIDS epidemic. So it certainly surpassed that.
Wow. Okay.
And to make it, I think, more realistic, if we can give you kind of a case illustration, maybe Dr. Tucker, you can speak about the quadriplegic that you treated and his circumstances and your willingness to challenge, this case and accepting him for treatment.
Yeah, so we had a patient who was in a motor vehicle accident some decades ago, abusing pain meds. Certainly has some pain, but obviously significant medical issues. Started abusing heroin. And, that kind of treatment with that level is pretty tough because here this person is not very mobile. And does need some pain management. So a lot of times you'll find people, especially when they're prescribed pain pills, you got to find alternative ways of treating pain. So and there are some non-narcotic ways to treat pain. So we tend to do a combination of things, not just detox,
Right.
but then also have to treat the patient too.
So can you back up a little and tell us what those non-narcotic ways of treating the pain would be?
Very good question. That depends on the person. Sometimes it's a combination of lidocaine patches, maybe higher doses of non-steroidal anti-inflammatory drugs, maybe some specifics of getting into some body movement, physical therapy. So there's usually a combination approach of trying to address the main issue as well as the brain's interpretation of pain. Because when you think about it, anywhere in your body, if there's pain, the brain actually interprets whether it's in pain or not, right?
Right.
So you'll see people after an accident or, who suffer from fibromyalgia or chronic pain syndrome, they have this over interpretation or sensitivity to their body sensation. And so their brain is telling me of pain, but really when you reset the brain and you treat them, they're really not in as much pain, right?
Okay.
And that actually, there's a good body of research that just shows if you didn't have anxiety before you started abusing opiates, you're going to have it afterwards. So
Because
opiates,
of your brain chemistry.
Opiates do change brain chemistry.
Yes.
The longer you're on it, the more. And these people will suffer from anxieties, or gravity kind of causes them to have pain, right? So they'll feel pain when there's nothing wrong with them. They'll feel every joint in their body. So then they go out and try to get the drug again. So you do have to try to treat not just the dependency and tolerance, because it's easy to detox. It's what comes next.
Yes.
Keeping them sober, it becomes the most challenging thing, but then you have to figure out what their brain needs to reset and not crave these opiates, whether they think they're in pain or not, whether they have anxiety or not. That becomes the most challenging part of it.
So ultimately, what did you figure out for the quadriplegic?
What
What worked?
Everything. So some PT, some movements, some non-narcotic pain treatments, lidocaine patches that address specific, because they have some contractures, obviously, because he's been, in the bed for so much. And so you try to address all these medical issues. And then also what the brain is interpreting. So if it's anxiety, stress, because basically when you think about it, opiates suppress the adrenaline system, so
Yes.
anything that when you take them away, you have this outpouring of adrenaline. The pupils dilate, you sweat, you have diarrhea, you have nausea, so it's just an outpouring of adrenaline. That's what the withdrawals are.
Right.
So you do things to try to suppress that, relax that, so they're not so sensitive.
Right.
So it's a combination approach.
Right, which
And
is
that's it.
interesting, and it's so exciting to hear that you have this available, because typically, and you can probably vouch for this, most psychiatrists, medical doctors are just prescribing something else, more meds, right?
Well,
And they're
because they went through the same era as I did.
Exactly.
You got to treat that fifth vital sign.
Yes.
This is just
But that's interesting.
It's just 2016 when they
stopped that.
dropped it, right?
Okay.
Oh, we were wrong.
And you were
Right.
talking about loss. I think for this young man, the loss of his usage of his limbs, the loss of
His
having a
health.
social life.
Absolutely.
everything. There's so many
Absolutely.
secondary losses. It's got to be
Absolutely.
overwhelming.
And another story, I had a patient, because we treat a lot of pregnant females.
Right.
And we had a pregnant lady, about 6 months pregnant, and sometimes patients, aren't ready for treatment. But this young lady was injecting heroin right in her stomach.
Whoa.
It's a very severe illness, and despite being pregnant and having an unborn child, she was willing to inject heroin in fine veins right in her stomach because she lost all her other veins. So this is a very serious illness that is affecting. There's no idea or picture of the typical addict anymore.
Oh,
you
no.
get people who are lawyers, doctors, first responders.
Absolutely. The face of an addict, it has
It's
changed
changed.
dramatically.
And that's the biggest difference too than the 50s, because the 50s it was that typical addict look and junkie look.
Yes.
But it's not anymore. It's
Absolutely not.
It's
Absolutely not. Well, let's stop for just a second here, guys. Thank you so much. And we're going to take a short commercial break.
And here's a thought, if any of this strikes home to you here, that we want to remind you today's show is being brought to you by our guests, Laguna Treatment Hospital, located in Aliso Viejo, right here in Southern California, offering clients a scenic, a serene, and peaceful environment for recovery. They offer residential treatment for adults with addiction and co-occurring mental health disorders, and they do medically monitored detox services as well, right on site. Laguna Treatment Hospital utilizes its own unique recovery curriculum. The course includes a series of workbook exercises and interactive activities designed to encourage self-examination, reach effective recovery, and aftercare coping strategies, as they talked about. Anybody can get sober. It's how do you stay sober? and highlights the benefits of the famous 12-step principles and fellowship. Loved ones are always encouraged to become active in the treatment process by participating in periodic family therapy sessions. For more information for you or any loved one or anybody you're concerned about, very simple, very confidential, simply call Laguna Treatment Hospital at 888-394-6324. That's Laguna Treatment Hospital at 888-394-6324. Or, if it's easier, go look at the websites. You can start with the largest one, American Addiction Centers, plural, American Addiction Centers, plural.org. Or if you want to reach out and talk to the doctor today here, Dr. Lawrence Tucker, Lawrence, drlawrencetucker.com. Many resources, many places to go. Take advantage of them. Share this information and save a life today. All right, we'll get back to some of these life-saving stories. Amazing stuff here. Somebody tweeted in and wanted to know, what's the most touching story? Is there anyone that just pops out of your head, the one that you just can't get rid of?
You guys have one?
Oh, yeah, there's plenty. I guess one of the most touching stories we have, that at least I have, I don't know if you remember back not that long ago, you heard about some of the couples that were passed out in their car.
Absolutely.
And their kid was in the back.
Yes.
There was a few stories of that sort. So we had, since there was a few stories, I'll just tell and share with you. One of the ladies that were involved in this, and her husband ended up not making it in their overdose, and obviously the kid was in the car, and she made it to our facility.
How old was the child?
The child was about, I don't know if that would give it away exactly who it is, but
okay.
a toddler age. Toddler age.
All right.
She came to our hospital, obviously from Ohio area, because that's where there was a period of time where there was a lot of fentanyl-laced opiates in that area. I remember one weekend there were like over 40-something overdoses within, like, I believe it was less than 24 hours. I mean, it was just incredible. So, and they ran out of Narcan, and they have problems saving some of them because of this. So it's generally made to us, and she spent over 30 days at our facility and made significant gains. She really turned her life around. And from what I hear, she's still sober and doing pretty well. Obviously suffered a lot of trauma and loss because, I mean, her husband was in that car, so there's a lot of guilt, depression, anxiety, PTSD. She had lost, I mean, she obviously, the custody of her child was taken away at this point. But from what I understand, she's still sober and is doing well, so it's pretty touching to hear that.
Wow. And all of those secondary losses, like you mentioned, that's gonna be quite a process for her.
Absolutely.
So I hope she continues treatment and continues to get help, because that's going to be a lifetime of resources that she's going to need.
A lifetime.
Yeah. So let's talk a little bit about prevention and give our listeners some hope in the midst of this national opioid epidemic. So we need to educate people that addiction is a disease, and I know there's been controversy about that it's a choice. So what do you have to say about the brain disease of addiction?
I mean, it is a disease. It is
Yes.
a brain disease. It affects chemicals in the brain and releases endorphins and dopamine, and hence causes euphoria and tolerance and dependence. And like I told you before, even changes the brain, right? Because if you know the anxiety that one continues to have, even when they stop using, they have these anxiety disorders too. So it obviously is doing something to the brain that hooks them, not just hooks them, but changes brain chemistry, that they go out and seek it again, despite the negative consequences, despite losing their jobs and families. I mean, it really kind of not just hooks you in, but brings you in, and you come to seek it. So it's a very difficult disease to treat and maintain for that one reason, because people are changed to some degree, and the relapse rate is pretty high. And what the danger of that is also, if you treat it and detox, whether it's on Subutex or Suboxone or other type of drugs that we use, you risk your relapse rate, once you do relapse, if you relapse, overdose can be pretty hot because your brain
Absolutely.
has been reset, and we're worried about overdoses. So the treatment is lifelong, really. I mean, because again, the brain has changed. So we try to do and encourage patients to stay involved in treatment. You know, whether it's getting on something like Vivitrol, which is an opiate blocker, the continuous on that, or if they're on maintenance, like on Suboxone maintenance, or other modalities to help maintain their opiate receptors, and so they're not drug seeking again, and prevent the relapse, prevent the overdoses, prevent them from drug seeking, and because there's the other factor in this, because you still have IV drug users of secondary illnesses, from HIV to hepatitis. I mean, these are epidemics too, because now you can transmit other things as well.
And, you know, I work in recovery. I do grief counseling at South Coast Behavioral Health in Costa Mesa. And so I am dealing with probably 70, 80 addicts at a time, right? And what's always so disheartening is their parents, their families, their friends think that it's a choice. They also think that if they've gone through detox and they've gone through a 30-day program, they're good to go. So there's so much lack of education out there that these addicts need support the rest of their lives. And it is not a choice. It is a disease. And like you said, and thank you for that, it does change your brain chemistry. And they're not the same as they were before their addiction, right?
Absolutely.
I think what's extremely helpful is when we have family programs is that we invite the doctors to come in and educate the families. I think they need to understand how the brain functions and why it is that it's going to be a lifelong struggle, and helping the families, because they're impacted as well and they're affected, and sometimes they are dealing with the loss themselves of a family member that they love that is just unable to stay in recovery and relapses. So educating them about this process, but also giving them the support groups that they need for themselves. And I think often they need to get into their own support groups. Al-Anon, a number of the psychoeducational groups that will help them just get strong and know how to be able to set limits, but still offer help. And
that's so important to involve the families. I think that's key to prevent relapse. They've got to have that support system.
They got to.
And I from speaking with the addicts, that they want the love and support of their parents, their siblings, but they also have a lot of shame, because there's a huge stigma that goes along with addiction. And also on the flip side, we have the parents who basically start grieving the death of their child when they find out that they have an addiction, because they are so afraid of getting that phone call at 3 in the morning that their child has overdosed. So there's that dynamic that's kind of a push and pull between the addict and the family. So I think that's great that you bring the family in and you try to educate them that, hey, this is not a choice. These addicts have a disease, and it's life or death.
Absolutely.
I mean, maybe you can speak as well, Dr. Zucker. I'm very fortunate to have a medical director that's very accessible to the consumer, to the customer. Our call center will often send us a referral, and they'll ask that they want to speak to the treating physician, or they want to understand what type of detox protocol is going to be incorporated. I think there's a lot of apprehension, reticence. They're afraid to get off their meds. They want to know what type of comfort meds are going to be offered, because then Dr. Tucker usually will take the time often to speak to the family, to speak to the prospective admit, to kind of convince them, persuade them as to how he's going to treat them, so that they're much more comfortable taking that risk and actually following through and coming in.
Oh, and that's so important. And I had a young gal who, 21 years old, and she has been through absolute hell. On the streets, homeless. Her substance of choice was heroin. And she disappeared for a few weeks, and I saw her back again last Tuesday, and I said, what happened? And she said, I relapsed, I was out on the street, I was homeless, and this is this tiny little 21-year-old female. And I said, well, what happened that made you decide to come back? And she said, the director and one of the therapists came and found me on the streets and said, we want to help you. And she said, just to know that somebody cared was enough to make me want to save my own life. So the fact that, you know, you are involved with your clients on a personal basis is so important.
Oh, it is. And actually, you see the patients who have more family involvement,
Right.
They certainly do fare differently than the ones without anybody.
Absolutely.
Is pretty striking. And then because there is so much stigma and people can get burned out in helping these individuals, and we know that the relapse rate is very high.
Do you know what the relapse rate is?
Oh, the relapse rate, Gil, is certainly up in about 50 to 60%.
Okay, I thought it was even higher than that.
It's high.
Yeah, right.
And they say relapse is a part of recovery, and it's to be expected that you have to. I think what we heard is just being sober, staying sober.
Right, that's the tough part.
That's tough. The most difficult aspect.
And because the brain has changed, if you don't adjust for that and really try to work with that and understand that, instead of it's never just a detox and get you out and go home and everything's fine.
If it were that simple, wouldn't that be wonderful?
You're actually changed.
So what about the population, Dr. Tucker, that had the tolerance, come into treatment, are off drugs, and then go back and think they can keep using the same amount?
Yeah, those are the ones that you really worry about overdosing.
Right.
You really worry about the overdose. And certainly there's a cohort of the overdoses that have been recently out of rehab, out of treatment. In other words, detox completely, sober for a period of time, and try to use.
Right.
So they're accidental.
Oh, absolutely. And even if they use a quarter of what they were using before they detoxed, that can be lethal. So that the lower tolerance is a real danger for relapse and overdosing.
Extremely.
Okay, so I wanted to ask you something. You were talking about the heroin being laced with fentanyl and carfentanil. Now, the carfentanil, if it's 10,000 times more potent than morphine, what about the first responders and people that are trying to help that person? I mean, can that be transferred through skin? I mean, what are the dangers of people trying to help somebody who's OD'd?
Yeah, there has been some cases recently of nurses who got really sick with touching patients who had fentanyl in their body, and they got sick. So this is so potent. It is very true.
Right.
Without gloves, of course. I mean, it is extremely.
If that can be absorbed through the skin,
it can be absorbed
and make you extremely sick to the point of near death. It's hard to even fathom.
It's amazing.
Right.
It's amazing.
Okay, so the warning signs of overdosing. Let's talk about those. I know the key to surviving an overdose is to respond quickly, but in addition to that, some warning signs like confusion meaning acting drunk, probably, mood swings, irritability, nausea, vomiting, extreme constipation. Your pupils are the size of a pin, breathing, sleepiness. Those are all warning signs, right?
Yeah, if you think about it, just like I said, opiates suppress the adrenaline system,
right?
Epinephrine and other things. So anything that's going to, if you can think about the opposite, so you're very, not very awake, not very lucid. You're right, the pupils are pinpoint because dilation means you're excited, right?
Right. And
when they're pinpoint, it's opiates or something that's suppressing the adrenal system. So all these things, and constipation, so anything that, basically anything like that.
Right.
And so the main point, though, is the respiratory depression, is decreased respirations. That is what is the extreme danger, especially, again, when you're mixing up with benzodiazepines, which is, unfortunately, or alcohol, or Ambien, or any kind of thing that also is going to suppress adrenaline. So that's when it's, or like fentanyl. So when you're mixing other drugs, and you'll see a lot of these deaths especially the accidental deaths, happen because of mixed drugs.
Exactly. And you know what? There are teens and young adults having parties out there, and part of the entry into the party is, you put in some mystery pills,
right,
and then you take something else, and isn't that fun to just experiment with some random pill. I mean, what is wrong with this?
And you'll see that really a lot in the teenage culture.
Yes.
The using, they call them bars, the Xanax bars, specifically the 2 milligrams. They're out there floating around the world here, and everyone in Orange County is one of the biggest ones with Xanax. And a lot of them, they'll take the Xanax, so the goal is not to have to drink too much. So if you drink 1 or 2 alcohol drinks and you're taking Xanax bars, you'll get extremely intoxicated. So they need very little alcohol.
But that's not always the case, right? They're taking
exactly.
a Xanax bar with plenty of alcohol.
And that's even worse.
And
right?
that's when we run into severe problems. So the key is to get into the schools and start educating these kids.
Absolutely. A few years ago, in 2013, I did go around and speaking with several of the high schools about addiction and drugs, and I have a presentation that I give to them and the parents. Mostly it was geared to the parents, but the kids were present too. So I made several rounds, like 4 or 5 schools that I spoke to. So,
awesome.
Because it was a period in 2013 or 14 where we had a huge spike in overdose and deaths in the Orange County schools. That's when I was asked to speak to a few of them. So.
And you know what? I think rather than just say, speaking to the kids, you don't say, just don't take drugs.
Absolutely not.
I mean, come on.
It doesn't work.
I mean, that didn't work when I was in school, and
No,
I didn't
not
have
at all.
access to much. But they need to know, they need to be scared of what
Absolutely.
these drugs are going to do them physically, their brain death, the changes in their brain. I mean, it's going to affect their entire life if they are able to survive it. So
Absolutely.
I really think that educators need to get out in the schools and get real with these kids. Don't just say, make a better choice and don't do drugs. That's
It
not
doesn't work.
working.
It doesn't work at all.
Right.
Another case comes to mind for me in regards to, you can't treat addiction, you can't isolate it because there's also mental illness. And I wonder, Dr. Tucker, if you can speak to the gentleman, the young man, that the father we spoke to, because his son was using substances, but there was an underlying mental illness that needed to be addressed. So, like, which do you treat first? And because we're a chemical dependency hospital, you were addressing the primary diagnosis of substance abuse, but then also beginning to treat the depression and also mental illness that was there.
That does make it a lot harder for treatment. It does, because for several reasons. The reason why someone who has mental illness, especially a primary thought disorder or other issues, uses is different than someone who doesn't. And it may not be totally clear. Maybe they just can't process what they're doing if they have schizophrenia, or they become manic and then they start using. So the reasons for using is skewed a bit. So you also have to address aggressively that mental illness piece. They can be very much more complicated to treat also, because typical 12-step may be not as effective as maybe with the other clients.
Right.
So the impulsivity, the unpredictability, the thought disorganization becomes a factor. So you really have to gear your program and your treatment to treat the detox and stabilization just as aggressively as you treat the primary mental illness. And then also keeping them stable and sober becomes a whole nother part of treatment that's lifelong too, because this person now also has a primary mental illness or primary thought disorder, where you have to keep that person stable, otherwise they're going to relapse.
Right. So you have separate treatment programs with patients for dual diagnosis then?
You have to.
Yes.
You have to. Again, because they
But
may
that's not always the case.
It's not always the case.
Yes.
It's not, because again, their reason for using is going to differ a lot from this other 50-year-old lady who has chronic pain and got started on prescription pills, or the 20-year-old who's just,
It's recreation.
for a recreational. This person has mental illness. You may not always understand why they're using, but they may not understand why they're using. That's the difficult part, because you think about 12-step, and then there's some cognitive behavioral concept and ideas of why the thoughts and behaviors why one uses. Well, the primary thought disorder person or other Axis 1 type of mental illness, it's a little bit more skewed, and you really have to address that, whether it's depression or anxiety, or rather its thought process.
Right. And you know, it's interesting because I've asked the clients that I work with, I want to know, you know, not all of the clients have some deep seated grief that they're trying to stuff, or not everybody has something in their life that they're trying to escape from. A large majority, when I ask them, what made you start using, responded, peer pressure. You know, they're 13, 14, they're going to parties, they want to fit in at school, and at that age your brain is undeveloped, right? So you have this need to fit in, and you will do what it takes to fit in. And it's sometimes that simple. It just starts out with wanting to be accepted just like any other kid.
Absolutely.
So,
and you'll see a lot of relapses like that too. You know,
yes.
it's like, well, why did you start hanging out with the same group you used to? I mean, you know they're using, oh, I thought I could handle it.
Oh, yeah. And then they've gone through detox, and their system is clean, and, you know, now they're overdosing, right?
Exactly.
And because you're saying that it's a disease, one adolescent can use recreationally and not be affected, and someone else can become addicted.
Right. Everybody's brain chemistry is different, correct?
Everyone's brain's chemistry. Now, of course, you'll see families. There is a genetic portion of biological. You'll see addictions run in families.
Yes.
And there's certain correlation to this. But you know, as far as opiates, you may not have any addiction in a family and start taking this and change your brain and get totally hooked. No addiction in the family whatsoever.
Yes. Do you find that most of your clients have that genetic component?
I'll say a lot of them do.
Okay.
You'll find a lot of multiple. I mean, we've taken people who, even the gentleman that Gil was talking about, his brother was in treatment with us at the same time. We've had family members, brothers, and our brothers and sisters in the same program. I mean, you'll see them, or they're in another program someplace. They're both in. I had this one kid, his father, the father and son were in sober living together, and they both relapsed. Father was in another addiction program, and he was at our program. So they were both going to rehab together. So you'll see a lot of family members and being treated. I have this. Actually, we have her now. She was using drugs with her mother. So they were scoring, and they would do things to get drugs, and they're both using together.
Right. Wow. No, I find that a lot too. It's a lot of times it's the parents that got them into using. So, all right, guys, I want you to hang on for just a moment longer, and we're going to take a short commercial break.
And again, just another reminder for those of you listening to today's show that we're talking with Laguna Treatment Hospital, located right here in Aliso Viejo. They're a special treatment facility offering a scenic, a serene, and a peaceful environment for recovery. They offer residential treatment for adults with addiction and co-occurring mental health disorders. And they do a medically monitored detox service right on site. Laguna Treatment Hospital utilizes its own unique recovery curriculum. The course includes a series of workbook exercises and interactive activities designed to encourage self-examination, teach effective recovery, and, most importantly of all, aftercare coping strategies, and highlight the benefits of 12-step principles and fellowship. Loved ones are always encouraged to become active in the treatment process, so this doesn't have to be a journey they travel alone. You, as a loved one, can participate in periodic family therapy sessions. For more information about all the programs they offer, call them, Laguna Treatment Hospital. I don't know what you're waiting for, if it's you or somebody you know. 888-394-6324. 888-394-6324. Or if it's easier, just go look them up on the web. The master site, American Addiction Centers, plural, American Addiction Centers, plural.org. Or if you want to reach out directly to the doctor, his website is drlawrencetucker.com. What are you waiting for? Do it today. What gets people started with this? Started in the treatment. It's a myriad of reasons why they start the thing. But is there a motivating? Is there something that finally gets you to do something?
Well, I will tell you that the number one reason, 1 in 10, and correct me if this statistic is not accurate, but 1 in 10 addicts seek treatment. There's 9 out of 10 that
Wow.
don't get help.
Wow.
The number one reason why an addict doesn't get help is cost, and the second reason is the stigma. And that's really what my show is all about. That's what I'm trying to do, is to help abolish that stigma of addiction and mental illness so that people that need it will get help. Part of the problem, too, is there's not enough resources. And that's why I'm so excited to have you guys here today, because the programs you offer, and excuse the cliche, but it's kind of one-stop shopping in addiction, right?
And further answer Paul's question, why do people come? I always ask that question. I don't know why. I always find it fascinating what people tell me. So every patient I see, when I evaluate, I ask them, why'd you come here? Why now? You know, I mean, you've been in like 5 or 6. The last one was a year. What brings you here, and why now? You've been using for the last year or 2. Why? I mean, you'll see everything from legal problems,
Yes.
from family, you know, whether women get their kids taken away or family kind of did an intervention to get them into treatment, or they're just tired of using, they're on the street and homeless, they get very destitute. So every answer is a little bit different, but there's a kind of myriad of those, or like the top 5 or 6. But it is fascinating what brings someone in at that particular time. If they've been constantly using, there is some point that they point to as why they came in now.
And don't you think that rock bottom for an addict is different for everybody?
Absolutely.
Right? I mean, I had a guest on the show who was a heroin addict, and he had relapsed time after time, and I said, what finally made you go in and get help? And he said, I was homeless, which he'd been before, but he said he found himself in the rain squatting beside a dumpster on a piece of cardboard that was urine stained, and he just thought, life can't be any worse than this, right? So that was rock bottom for him.
Absolutely.
And the stories continue like that. They're homeless, and even sometimes then being homeless and being in situations where we can't even imagine is not enough to make them stop, right?
Exactly.
I mean, that's why you saying your brain chemistry is altered. That explains it, right?
Exactly.
I mean, a normal person, if you're on the streets, sitting on a cardboard box in your own urine, I mean, how much worse is that? Can it get than that, right?
Or if they go out and seek it again, don't you remember where you were at like a year ago?
Right.
I mean,
yeah.
you
What?
know,
Do you want to go back to that? How can it get
exactly.
worse?
That's how bad this drug
But that's
is.
why we need to understand their brains have been altered, and it's a disease, right? And you know, they can't resist even if they want to a lot of times, right?
Even the ones who really, really try, you know, they start drug craving, and that's why some aspects, we offer different modalities, everything from 12-step to Celebrate Recovery to even Smart Recovery for those who prefer that.
Right.
Whatever they get engaged in and stay engaged in, they're more likely to continue their sobriety because they have to actively work a program, as we call it, whatever that program is, to maintain that sobriety every day.
And you know, when I ask the clients, all right, they'll tell me that they've had 3 months clean, or 6 months, or when they've had kind of a long stretch clean, I will ask them, what did you do during those 3 months, those 6 months that worked for you? And almost 100% say, I was working the program, I was disciplined, I had a plan, I was busy, I was going to meetings, I had a sponsor. So it's so important. And the minute they start letting some of those tools go is when they're in danger of relapsing.
Absolutely.
It's one day at a time.
Yes, one day at a time.
And that's another reason why it's so difficult for that person who have coexisting mental illness
Yes.
to stay sober. Because now it's not just working a program, but if it's a mood state or mood independent state that drives into relapse, or it's a thought process disorder, or there's other significant trauma, then the relapse is not so, they can be working a program.
Right.
And still relapse because
Yes.
it's these other things it's this other
That's a good
variable that
point.
comes into their play. They can be working a perfect program and have a sponsor and talk to a sponsor, and then just all of a sudden snap, or it becomes more insidious and gradual depending on their mood state.
Right. So everything's got to be treated simultaneously.
Everything has to be treated.
Okay, guys, what advice do you have for anybody out there listening that may be struggling with addiction today, and they're listening to this and they're thinking, you know what, that's me. I think I need help. What advice do you have for listeners out there that are in that situation?
You know, I think it's not as easy as one can just proclaim or make one statement, but I think it's, you know, becoming aware, educating yourself. You know, Google places, there's sliding scale clinics, there's public sector that offers funding for treatment. You know, the private sector, I think, for, you know, young adults that are dependent on their family's insurance, I think that's key, because then they can seek private counseling and private treatment. You know, treatment is costly. However, there's lots of alternatives, and there's still availability out there that people can get help.
Right, and that's such a good point, Gil, is first acknowledge that you need the help, right? That's the first step. Own the fact that you're an addict and that you need help. And that's the tough part.
That's the tough
right,
part.
Right. All right, so thank you so much, Gil and Dr. Lawrence, for coming on my show today and for sharing all this important and life-saving information with me and my listeners. So again, if you have any questions or comments, you would like to contact Dr. Lawrence or Gil Carmona, you can be reached at...
You can be reached at AmericanAddictionCenters.org. And like Paul said, my website is drlawrencetucker.com.
Thank you so much. So for all of you listeners out there, if you have a topic that you would like me to cover, or better yet, if you yourself would like to be a guest on my show, I would love to hear from you. So for questions, comments, please contact me at thegriefgirl.com. So thank you so much for tuning in today. And until next time, remember, grief is not the enemy. Grief is the teacher.
You've been listening to The Grief Girl with Christy Huckstad. Stay tuned for next month's collection of anecdotes, insights, and inspirational stories to help us tackle the only remaining taboo topic, grief.